Everyone is streaming. Streaming is the new word. It's not television. It's not TV. So why call it telehealth? Call it virtual care, with the idea that at some point you're going to drop the virtual part and just call it care, that it will be a commonplace thing that you buy insurance from a health plan, and the health plan says, yes, use this app to talk to your doctor.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we are fortunate to have the CEO of Wise Healthcare, Sajid Ahmed. Sajid, I'm going to call you Saj. Is that all right?
That is perfectly fine.
Tell us a little bit about Wise. The name Wise Healthcare uses the moniker, the force of new.
Yes. So we were very intentional in launching our company Wise, and what Wise stands for is actually an acronym. It stands for Workflow, Innovation, Sciences, and Engineering. One of our key focus areas is to help redesign how healthcare is delivered in all the settings, clinic settings, specialty settings, hospital settings, both at the front end, where doctors, nurses, and frontline staff help to manage that patient intake, patient care, and follow up with the patients afterwards. But we also help support the business of healthcare at the back end that helps supports that the financial and the business aspects of that care. And a great example of something that we do is virtual care, known colloquially as telehealth, telemedicine. We call it virtual care. We help implement virtual care processes and technologies. We support stuff like e-consult, teleconsult, telepsych, behavioral health. And that's one part. And the other part that I'm excited to tell you about that Wise does is we also support and have products in artificial intelligence that do decision support at the physician level and at the consumer level. And finally, when you ask this force of new, that was also very intentional. It speaks to what we want to do in healthcare, in helping make healthcare better for the everyday person, for our family, for our relatives, for our friends, for those of us that use healthcare. That's very important to us. And part of our focus is really in the safety net to help the underserved populations. That's where I've spent most of my last 15 years of my healthcare career. Of the 25 years I've been involved in healthcare has been in the safety net. And I think if we can make changes on the safety net, we can make changes elsewhere in the healthcare environment.
That is quite an aspirational view on the plethora of things involving healthcare. Looking at all the dimensions, including the social determinants, it sounds to me, Saj, like this is an application of disruptive innovation. That might be in some areas a pretty aggressive game-changing technology. You talk about the word telehealth, and we've heard that term many times before. I know you've written a paper on dropping the tele from telehealth and really adopting a different perspective, using the term virtual health to replace telehealth. But before we get into some of the concepts of virtual health and the new ways of creating value, give us a little background on the history of what telehealth and telemedicine is, so our audience can have a better understanding of where we are coming from and to where we're heading.
Absolutely. So telehealth, or telemedicine as it was originally known, and really it's still known as telemedicine in the academic world, especially at academic medical centers, originated actually with the U.S. military, the U.S. Army, about 50, almost now, I have to update that, almost 65 years ago, post World War II into Vietnam and Korea, when the technology was just getting up to provide remote care on the battlefield with a physician that was at the MASH unit. That's been evolving. The U.S. military has been kind of pushing that, providing care remotely in the battlefield scenario with doctors that are far removed from the battlefield. Fast forward to 30 years ago, when teletechnologies were a little bit less onerous, less expensive, the application came to rural areas. How can we provide care to rural areas from major city centers? So there was a big movement to have a lot of these academic medical centers provide that specialty care remotely using, at that time, really large cameras with television screens and some diagnostic devices. But in the last 15 years, we've seen this revolution in information technology. And in particular, the last 10 years with the advent of the iPhone coming out in 2007, all the apps where every device has a camera, a high-res, high-tech camera, and almost everyone, regardless of socioeconomic status, seems to have this computer multifunctional device in their pocket that we call the smartphone, the cell phone. And so there's been an acceleration of, well, wait a minute, we're all using these technologies to buy our products on e-commerce, on Amazon, or wherever. We're getting our media delivered through this device. We can do so much through this device. Why can't we talk to our doctor through this device? Why can't we text? Why can't we have specialty conversations with our primary care doctor in their office with a specialist? So in the last few years, there's been a revolution. But going back to that history, it's really started out as a very simple way of how can a doctor that's not there provide care remotely? And it's been evolving. But I'd say the last 5 years, we've seen a transformation. We've gone from telemedicine, and there are still telemedicine aspects, such as providing remote surgeries using the Da Vinci devices that we know, where a doctor or surgeon can use his computer and other tools attached to his computer far removed, hundreds, if not thousands of miles away, and perform surgery in real time because we have this bandwidth internet structure.
I'm trying to make this more on a personal level. I'm sure there's a play for direct-to-consumer and even provider-to-provider mode for virtual health. On a more personal basis, there's a lot of things you may need to do for your family's health, but they don't want to go to the doctor's office. So usually there's a lot of healthy people sitting around in the waiting room, right? No, not the case at all. On a personal note, if you ask someone who's sick, if you take them to see the doctor, they'll tell you they're fine. They'll feel better in a couple of days. A couple of days will pass and they're still sick. So I learned not to listen to sick people. They say they're getting better, but they really aren't. I can see a situation where I can pull up my iPad and have a doctor on the other end. The doctor can say, hey, let me see, let me hear, let me get involved with you here and try to figure out what's going on. And the doctor says, you've got pneumonia. Get in here now. So my experience is they'll listen to a doctor before they'll listen to a family member or a spouse.
Well, so, I'm probably the epitome of optimism and think of myself as an innovator, but I'm also very practical too, as a father and husband, as in our time of life where we're taking care of both our kids that are growing up and getting ready for college, as well as our parents who are getting older and being so busy. It's a natural evolution to have the convenience of this device that we have in our hands, the cell phone, the smartphone, to be able to use this to contact our doctor, not just a phone call, which is difficult to do, but a real way to communicate, either through an e-consult-like approach, where I'm sending a secure text message with a picture of a rash or some injury and saying if it's necessary to come in or not, or if I'm using smart AI decision tools on top of that. But this tool, it's about access to the doctor. And so the doctors and the nurses and the healthcare system that supports them and how it's reimbursed is not conducive to this type of communication, convenient access. Now, we know there are some companies that have come around, American Well, Amwell as it's known right now, and Teladoc. There's a number of other smaller ones that have come out recently that are trying to provide this service, getting doctors that will get paid and reimbursed to be available so that you can use your device, do a video chat, do a text chat, or even a direct call and talk to them and get that initial concern and combine that with the fact that now you have these smartphone devices, the iPhones, the Samsungs, all these Android devices that come with these wearables that you have. Your smartwatch can now record your EKG. You have all these sensors that your smartphone can capture on your health. and behavior that can be all sent to the doctor as part of that communication. So we're at a very interesting, I believe, inflection point in healthcare over the next 2 up to 5 years, where you will see more and more consumers of healthcare like you and I, our spouses, our parents, the grandparents, the kids, especially the kids, the millennials that are coming up and the millennials after them that are coming up that have only known to use this device. They order food on it. They do their banking on it. They do they do everything on it. So they live on it and it's attached to them. So why not have this opportunity to redesign healthcare to provide that, which is why I don't call it telehealth or telemedicine, because, no one watches television anymore. Everyone is streaming. Streaming is the new word. It's not television. It's not TV. So why call it telehealth? Call it virtual care, with the idea that at some point you're going to drop the virtual part and just call it care, that it will be a commonplace thing that you buy insurance from a health plan, and the health plan says, yes, use this app to talk to your doctor. Use this app to talk to a primary care or a specialist doctor before seeking care inside a facility like a hospital or an ED or even an urgent care. But if you need to go, great, that doctor can help you wherever you're at, whether you're at the store shopping, whether you're at work, so you don't have to take time off of work, make an appointment. So I think there's this massive revolution where we can use these devices, our personal handheld cell phone, smartphone devices, to access care. We're just trying to, I think, help redesign the healthcare business. The business of healthcare has to support that model. And I think that's where it's headed. I think it's going to be transformative over the next 2 to 5 years. And you and I will be talking again in 2 years saying, are you using Alexa to access your care through Amazon? And the answer will be absolutely.
I think there's a social element that if people are understanding and know that the technology is there and it's easy to use, they'd use it. Is that part of the difficulty in getting people to adopt this technology? Is it age dependent?
Correct.
The word virtual care may fall into the era of obsolescence. In the past, you might get a call that was long distance. Hurry up and get to the phone. Uncle Henry's calling and it's long distance. You race to get the phone because it's very expensive. Long distance is now obsolete. Virtual care may be turning into just care, no more virtual care, as it advances further into the future. WISE is headquartered in California, which is very progressive. How well has the adoption of virtual care using technology like you described spread across the rest of the country? I understand California lets you use technology of any kind that you want as long as there's a doctor on the other end. How about the other states? I heard it said that the future has arrived and is here. It's just not well distributed everywhere.
I think you have to think of it in a more holistic fashion, in the sense that in every state, there are young folks like us that are working to support our families day to day like everyone else does. And then there are the older folks, the retirees, the baby boomers that are coming out. And yes, though in California, it's progressive. California is a very large state, and I think it's somewhat representative of that stratification of folks. And at each level, there's a different habit and a different expectation. So I know for a fact, like my parents, the grandparents, as we call them, they will still go inside a bank to do banking. They're from that generation. Though my father-in-law, who's been seeking care constantly at the local hospital because he's in his mid-80s and has some heart conditions that he's been seeking care for, he finally got fed up with waiting for his test results. And he asked me just the other day, can you put the hospital's app on my phone so I can look up my labs? So that reminded me that when people have a need that is driven by pure convenience and pure need to get access to information, then I think that spurs the use of technology. I think the challenge is that in the other rural states, especially in the rural communities, access to high-speed bandwidth is still very limited. You almost have to go to your local Starbucks to sit there and get high-speed bandwidth. And I think there's this massive disparity that still exists in the U.S. with access to basic internet service, high-speed internet service. Other developed countries, in particular in Europe, provide speeds greater than we have on average available here in the U.S. Especially in California, we have high speed almost everywhere. So I think if there's a major difference between California and perhaps the other major city center states versus the rest of the country that's still predominantly rural. I think it's this access to reasonably priced, if not almost free, high-speed internet access. And I think it's a travesty. The telephone companies used to charge for long-distance calls. And as you mentioned, there's no such thing as a long-distance call. In fact, calling on your phone is free. You just pay that subscription fee with your carrier, that whatever $25 or $50 a month. But you can make as many calls as you want. So I think we need to get there. And we're not there yet with our carriers and internet service providers. They still charge a premium for higher bandwidth. They still charge a premium above your subscription rate. And I think as long as those technical barriers exist, adoption and use, especially for convenience, will be limited. Because if it isn't convenient to log on and have good high-speed internet to talk to your doctor using virtual care, I think that's going to be the challenge. And that's one of the main barriers I see to widespread adoption and use of healthcare business delivered through the phone, delivered through the camera on your smartphone. And I think that's something we need to address at a policy level.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
I'm going to switch gears a little bit here, Saj, and talk about another topic that's in the news a lot. I know that you've seen it a lot in different areas in healthcare. That is AI, artificial intelligence. In a recent course here at the university, we had a deep dive with our class of physician leaders on the topic of AI. It's being used in a variety of specific areas within medicine with a lot of good success, such as imaging, radiology, using video to review a colonoscopy, and even retinal exams, quite often outperforming the doctor. You also hear about AI will replace people in a lot of manual job functions, and the future will be redefined with AI. What's your perspective on its impact? I know you have expertise in this area. How does AI fit into the average person's life? How does the general public access the concept and practice of AI? I know that if we're introduced to electricity via the electric chair, we'd be afraid to turn the lights on. How do we introduce AI to the healthcare users so they're not so fearful?
That's an excellent and very smart question you're asking. There's a couple of nuances that you posed. To answer that last part first about how to introduce the artificial intelligence technology into healthcare and how to introduce that concept as a value add to consumers of healthcare that might be wary of AI, I think that's an excellent question. I will tell you this, that artificial intelligence has been around for a very long time. In fact, it shares a little bit of similarity with telemedicine. Telemedicine has been around for a very, very long time, but only now that there's high-speed internet, bandwidth, everyone has a device, and the technologies are absolutely inexpensive or almost free to connect with a doctor. We see this resurgence of telehealth, or virtual care as we call it, into new business models in healthcare. AI shares that same history because AI was created as an academic study in the 1960s. And one of the first applications of AI was actually thought to be in medicine. In fact, some of the early software tools that ran on these ancient mainframes were for medicine. And of course, fast forward to now, similar to virtual care, you've got computers everywhere. We have computers that are stronger, faster, have more memory in our pockets than we did 10 years ago, or even 5 years ago for that matter. So artificial intelligence has seen a resurgence in a number of industries in the past 10 years because of these available technologies, and the costs of these technologies are dropping every year significantly. But AI in healthcare poses an interesting challenge. The way artificial intelligence was introduced to the public at large has been through the movies, through Hollywood. And AI, unfortunately, has been seen as the bad guy or as some sort of flawed reflection of human character. And you could see it in shows from Stanley Kubrick's Space Odyssey with HAL, the malevolent or confused AI that tried to kill the astronauts, to Terminator, to Star Trek, which provided a brighter light on AI. But I think what's happened recently is that we've had other AI-backed tools that have been introduced. Alexa, Cortana, our Google Assistant, Siri, on these smartphones. They're all AI-based. They process our speech naturally using AI speech recognition. They understand what we're saying through these AI algorithms. So I think people are becoming comfortable with using these tools. Now, Alexa and Siri, in particular, Alexa that's on at home, some people are cautious. Who's listening to me all the time? What is Alexa doing with that information? What will AI do? So I think there is a challenge, but the value that AI can add, and you mentioned a couple of examples of AI can be very good at reading radiological images, MRIs, faster, better, more accurately than a human eye can. And that is a fact that is proven in literature. There's reliance and confidence on that, and it's being implemented right now. But other forms of AI in healthcare, I think, will be kind of silent or not directed to the consumer directly. AI such as looking at the back office operations of a hospital, for population health management, for financial management, to drive costs lower. I think there's great opportunities for AI to be used to analyze all this data that's been accumulated. But the part that I'm really excited about is that there's great strides being made in AI for decision support, both at the physician level and the nurse level, to make that physician and nurse better at the care they provide more accurately, to remove unnecessary errors that occur in the natural delivery of healthcare so that nurse has the information they need on a patient. The physician is able to make better decisions using an AI support that goes through your medical record. And then, of course, to the consumer, there are tools that are coming out right now. In fact, one of the tools is something that Wise is working on, and there's a couple of companies that have been funded that are bringing out these tools where you have an agent in your hand, where you have an AI decision support for you, where you talk to it just like you'd be chatting with a person or a virtual doctor in this case, and you can get that initial assessment of whether you need to go to a hospital or not, whether that rash on your child is a deadly allergic rash or just a common rash that can be looked at a regular time by a doctor, or if that cold is just a cold, or is it the early symptoms of pneumonia, which can be very deadly. So AI decision support for consumers like us, when we're running around, when we're at work, traveling, busy with our family, we can use these tools first, get an assessment, and then I think the real value add is then connecting it to a virtual doctor that you can talk to remotely or text and say, I just used my decision support agent. What do you think, doc? Because right now, the confidence level of AI in healthcare is roughly 50-50. And actually, the confidence level with physicians is around that to provide accurate care is not too much higher than that. It's around 60%. But when they did a survey and said, what if you have a doctor using an AI tool, or that you use an AI tool to support the doctor? What's your level of confidence? And it's well over 85%. And I think so the combination, not exclusive use of AI, is a good way to introduce AI in healthcare as a positive tool for consumers.
So it doesn't need to be rocket science here. Safe to say it's pretty straightforward.
Yes.
I really enjoyed learning, Saj, about what you've done with this technology and how it defines many new possibilities for the business of healthcare. We need more disruptive innovation. Saj, I want to thank you for joining our podcast today and look forward to staying in touch with you and learning more. Thanks for your time today.
No, and thank you for the opportunity to share some of my thoughts and the goals that we have for everyone in healthcare, is to help make that healthcare experience better and easier for people to access and more cost effective. So thank you. I really appreciate the time.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.